Hello, how are you?
I'm doing well. How are you?
I'm doing well. My name's Keegan. I'm one of the nurses on the floor. I'm going to provide some privacy real quick. Practice hand hygiene. Wash my hands for 20 seconds. 20 seconds. All right, so I'm here to do your assessment for you. What's your name?
My name's Brianna.
Nice to meet you, Brianna. All right, so we did hand hygiene. We practice all maintenance of precautions, hygiene precautions, and we're going to wear gloves during the assessment. All right, I'm going to ask you some questions. What is your age?
I'm 22.
What is your sex?
Female.
What is your date of birth?
January 4th, 2001.
What year is it?
2023.
The state of consciousness of the patient is normal. The appearance of the patient is normal. Do you have any physical deformities that you're worried about?
No.
No physical deformities. The mood and affect of the patient is normal. The speech pattern of the patient is normal. What is your height?
I'm 5'6".
What is your weight?
About 150 pounds.
The BMI of the patient is about 24. That's within range. All right, now we're going to move on to the subjective data regarding your organ systems, starting with neurological. Do you get any headaches? Have you had any head injuries, or do you get dizziness?
No.
Do you get seizures, tremors, weakness, lack of coordination?
No.
Do you get any paresthesia, which is pins and needles?
No.
Do you have difficulty speaking or swallowing, or having environmental or occupational hazards?
No.
All right. Have you ever had any signs of stroke, such as facial droop, arm weakness, difficulty of speech, time that you've had to call 911?
No.
All right, perfect. Moving on to your abdomen. Have you had a loss of appetite or dysphagia, which is a difficulty of swallowing?
No.
Have you had any intolerance of food?
No.
Any pain of the abdomen, nausea, vomiting?
No.
What are your regular bowel movement habits?
I'm fairly regular. I go at least once a day.
Okay. Do you have any abdominal history that we should keep note of?
No.
Alright. Have you done any drug therapy in regards to your abdomen?
No.
Okay. What is your nutrition usually?
I have a very well-rounded diet. I eat a lot of fruits and vegetables, and then a lot of meats and fiber, protein.
All right. Normal nutrition. Now to skin, hair, and nails. Do you have any skin disease history?
No.
Do you have any pigmentations or moles that you would like to evaluate?
No.
Do you have any excess dry or moist skin?
No.
Any pruritus, which is itching, or eczemosis, which is skin discoloration?
No.
Do you have any rashes or lesions?
No.
Have you taken any drug therapy for your skin, hair, or nails?
No.
Any hair loss, nail changes, or any environmental or occupation hazards that would impact?
No.
All right. Thank you. All right. Now for head, face, neck, and regional lymphatics. Have you had any headaches, head injury, dizziness, pain, or limited range of motion of your neck?
No.
All right. Do you have any lumps or edema? Edema being swelling?
No.
Do you have any history of head or neck surgery?
No.
Perfect. All right, now for your eyes. Do you have any difficulty of vision, which includes double, blurry, blind spots?
No.
Do you have any pain or diplopia, which is double vision?
No.
Any strabismus, which is poor eye muscle control?
No.
Any erythema, which is reddening of the area of the eye?
No.
Any edema, which is swelling?
No.
Any discharge or watering or sight problems?
I do have an astigmatism, so I do have to wear glasses for that.
Okay. How long? So you wear glasses and contacts?
Yes.
Okay. How long have you been using those?
I've been using them for about 13 years.
Okay. Any glaucoma?
No.
Okay. Perfect. All right. Now we're going to go over the targeted organ system, the objective data. First, we're going to start off with the cranial nerves. Then we will work our way down. All right. So starting off with cranial nerve number 1, I'm going to hold a strip up to your nose. You tell me what you smell.
It smells like coffee.
Perfect. All right. Now we're going to do the visual field and Snellen chart for optic nerve, cranial nerve number 2. So you tell me how many fingers I'm holding up.
1, 2, 5, 2.
Perfect. All right, now you're going to tell me the letters you can read on the chart, the lowest.
E, A, B.
Perfect. All right, now we're going to assess cranial nerve number 3, 4, and 6. So we're going to use the pupil and light. Can you just remove your glasses from me, please? All right. Perfect. Normal findings. Then we're going to do the cardinal positions. Just look at the tip of this. Normal findings. All right, now for lens accommodation, just stare at the tip. Normal findings. All right, moving on to number 5. Cranial nerve number 5, I'm going to have you clench your jaw, then open it. Normal findings. And then I'm going to assess any sensation. You're supposed to use a cotton ball, but we don't have a cotton ball. All right. Do you feel? Okay. Normal findings with 5. All right, moving on to facial number 7, cranial nerve number 7. Can you smile for me? Frown for me? Close your eyes. I'm gonna try to resist. Perfect. All right. Can you raise your eyebrows? Can you show your teeth? Can you puff your cheeks? Perfect. Normal findings. All right, acoustic, cranial nerve number 8. If you could just stand up for me, please. Then face towards that direction. Can you rub your finger on your ear, and we're going to do the whisper test. Tell me what you hear.
I hear A, E, B.
All right, next ear. 1, 2, 3.
1, 2, 3.
Perfect. All right, then if you could just, we're going to do the Romberg test while we're here as well. Normal findings. If you could just walk in a straight line for your gait test. Perfect. All right, you can sit back down. Thank you very much. All right, moving on to cranial nerves number 9 and 10. I am going to depress your tongue. We're going to assess your tonsils. All right. Can you go, ah? 1 second, sorry. I forgot. All right. Perfect. All right. Now I'm going to assess your gag reflex. All right. Oh. All right. Sorry. All right. No gag reflex found. All right. Next, cranial nerve number 11. Can you resist turn your head towards my hand. Perfect. Next. Perfect. Shrug your shoulders. Perfect. Normal findings. For cranial nerve number 12, can you stick out your tongue for me, please? All right. Can you move it around? Perfect. All right. Can you pronounce the letters LTDN for me, please?
LTDN.
Perfect. There's a light enunciation. All right. So now we are going to move on through the neurological system. We're going to assess ataxia. Can you flip your hands up and down for me quickly? All right. Touch all your fingers with your thumb. Back and forth. Perfect. All right. Can you bring your finger to your nose? Sorry, finger from your nose to my finger as quick as you can. Perfect. Normal findings. All right. Balance test. We did that already. The Romberg test. We already did that. We are going to do sensory evaluation for pain and then light touch. Can you tell me if this is dull or sharp?
Dull. Sharp.
Perfect. All right. Can you feel?
Mm-hmm.
All right. Normal findings with pain and light touch. Now we're going to do stereogenesis. Can you close your eyes for me, please? Stick out your hand and tell me what's in your hand.
It feels like a pen situation.
Perfect. All right. Now if you could keep your eyes closed, and we're going to do graphesthesia, and stick out your hand for me. I'm going to draw something on your hand. You tell me what you think it is.
It felt like a capital B.
Perfect. All right. Moving on. We're going to do the deep tendon reflex with our hammer right here. All right. Ready, and there we go. All right, let's do your elbows. Perfect. And perfect. All right. Deep tendon reflex is normal. We did the neuro check already. We did the pupil response, which was normal on the Glasgow scale. She is normal for spontaneously opening her eyes. Can you move your fingers for me? Perfect. 6 for motor response. Can you tell me what year it is?
2023.
That is correct. So that is a 5 for verbal response. Normal findings. Moving on to head, face, neck, and regional lymphatics. I'm going to do a skull evaluation, a facial structure evaluation, a frontal maxillary sinus evaluation, and range of motion. All right, so we'll start off with the range of motion. Can you just move your neck around in all different directions? All right, normal findings. I'm going to do the skull evaluation along with face structure. Is there any pain whenever I go like this?
No.
Any pain for your maxillary sinus?
No.
No? All right, perfect. Normal findings. All right, now we will do the lymph nodes, the cervical and supraclavicular. All right. Normal findings. Now we will assess the trachea, the thyroid gland, carotid palpation, and the auscultation. All right, so I'm going to use the 2-thumb technique for your thyroid. Normal findings. Trachea is normal. We are going to auscultate first we'll palpate the carotid. Normal +2. Now we will auscultate the trachea and the carotid. First I'm going to listen to your carotid. Normal findings. Can you breathe in for me? Breathe out. Perfect. Normal findings. All right. Moving on to the eyes. We did the Snellen chart evaluation already. We did the confrontation test already. We did the corneal light reflex already. We did the cardinal directions already. I'm going to assess the conjunctiva, the sclera, cornea, pupillary light reflex we already did. We did accommodation, and then we will do the rest of this. Okay, so you can look straight ahead for me. All right. Normal findings. The conjunctiva is normal. The sclera is normal. Cornea normal. The pupils are equal. They are round. They are reactive to light and accommodating. All right, moving on. Sorry. All right. So for the abdomen, you can just lay down for me. All right. So we are going to assess symmetry, normal symmetry. The umbilicus is normal. Umbilicus is normal with no protrusion. The skin is normal. Hair distribution is normal. I'm going to assess the bowel sounds in all 4 quadrants. I'm going to do this quickly, just for the time's sake. 1, 2, 3, 4. All 4 are assessed, normal findings. The abdominal tympany is normal sounds. Light and deep palpation is what we'll do next in all 4 quadrants. Light, 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 light. Any pain?
No.
All right, deep palpation. 1, 2, 3, 4. All normal findings, no pain. Now we will do the costal vertebral tenderness. Any tenderness there? No tenderness. All right, moving on to skin, hair, nails, and lymphatic. Skin, hair, and nails. All right, so the general hair and skin and nail pigmentation is normal. We're going to assess the temperature. Can you put your hands at your side for me, please? Perfect. Normal temperature for the skin. The moisture and texture is normal. The thickness we will assess with the turgor. All right, so we're going to do a turgor test on your chest. Normal findings, the thickness is normal. There's no edema on the skin. There's no ecchymosis. There are no lesions. We are going to assess capillary refill. Can I see your other finger, please? Normal capillary refill. All right. And that puts us at the end of this assessment. First, I'd like to thank Bree for helping me out. Second, to go off of some things that I did well. I think I did well with, kind of getting through everything pretty quick, seeing that our first video was 30 minutes long. Definitely wasn't, I would have wanted to go more in depth and give like the patient experience rather than making the patient feel more like, oh, this is a race, we got to get it over, we don't have time to get it done. But I hope that didn't make anything seem too weird. Places I could do better, and just knowing exactly what step I want to go to next and being more fluent with it. And yeah, I think everything went pretty well. Just have some more work to do on being more knowledgeable and being able to streamline everything, I think. So yeah.